Thank you very much, Madam Chair, and Director LaBelle. Thanks for being here. Appreciate it very, very much. I'm encouraged by the interest shown by ONDCP in pursuing mental health parity. We try and do that in Oregon. It's a huge benefit at minimal cost, and I'd argue saves millions of lives and a lot of money in the long run. Just like we've been talking about here, access to treatment is a huge issue. And while payers can't create more providers, ensuring that they cover the ones that exist is one piece of the puzzle. So in that regard, what policies is ONDCP considering to encourage the growth of substance use disorder providers?
So what we're doing is making sure, obviously, that there's quality treatment. As you mentioned, the parity work, we did quite a bit of that when I was here at ONDCP last. We need to catch up to see where the barriers still exist to parity. We need to work with Department of Labor, is the agency that administers and enforces the Parity Act. So we'll be working with them to determine where the gaps continue to be.
Very good, excellent. And others have spoken about this too, but the last March, millions of Americans that were getting treatment for alcohol, cocaine, methamphetamine, marijuana, fentanyl, heroin addictions basically lost access. There have been some creative opportunities through telehealth to help in that regard. And so given the constraints that we have encountered with the in-person care, is ONDCP given any consideration? The field, the FDA cleared and regulated products called prescription digital therapeutics that use software to treat serious unmet medical health needs. And if so, how so?
Sure, thank you for asking that. So clearly there are lots of innovations that have come out across the country to address this need. I mean, the technological innovations kind of abound, which is great because, as I said before, our policy priorities is about increasing interventions at every single point and removing barriers. And technological advances, such as the one you identified, that's something I need to look into a little bit further, and I'd be happy to talk to you about that more.
Well, that'd be great. Like to have you work with the committee on the opportunities that are there. My understanding is that the products actually have accountability and support features built into them, which are both very, very important in terms of follow through. So I want to make sure that while these apps and opportunities are there, they're actually doing what we want it to do and can register improvement from our patients. So if you'll work with us in the community, I'd appreciate it.
Sure. Thank you.
Thank you. And Madam Chair, I yield back.